So Ian, I think we're all agreed that the health service has been a great achievement of the country over the last 80 years. And I don't think anybody is wanting to change the institution of the NHS. But is it still fit for purpose? Can we fix it a little bit to make it better? Or do we need to have a more fundamental appraisal of what it can deliver?
The NHS was an incredibly bold experiment and move in 1948, and it perfectly fitted the epidemiology of disease and the state of society at that time. People died at the age of 50 or 60, often within 6 months of their terminal illness. So there wasn't a need for out-of-hospital care.
One of the ways in which you can see that, of course, is in cancer. In 1945, chemotherapy, standard cancer treatment and care now, wasn't even discovered or invented. And as we know, 1/3 roughly of all deaths are from cancer, but cancer now, of course, is a chronic condition. So whereas in the 50s and 60s, you'd go in and if it was early enough, you could have successful surgery. And broadly speaking, hopefully, if that was enough, you would live. If you didn't, of course, you went home and died. So now as cancer itself becomes a chronic disease, we actually have expanded the problem as well as the issues around mental health and non-communicable diseases like diabetes.
Absolutely. And we made acute care chronic, as you say, because people can now live with cancers. The ageing population, again, another result of the advances in biomedical science, but those patients have comorbidities. They'll have dementia, they'll have some cardiovascular issue, they might have cancer, so there's much more complexity out of hospital. But the system has stuck in 1948, and therefore we're not caring or not meeting the needs of the population in 2016.
Yes, I think one of the advances that has latterly been recognised in the health service is the crucial importance of diagnostics. Going along to your general practitioner with your lump in the breast and the GP somehow knowingly scratching his head or scratching his nose and trying to decide whether you've got a cancer or not, I think we all recognise is frankly ridiculous. And yet the opportunity of mass x-rays, MRIs, etc. has never really been developed in the NHS because the structure we had was big hospitals and actually what you need is a distributed but highly complicated diagnostics systems. And our system, because it was so centralised, has found that very difficult to create these more broader but smaller organisational structures which would provide the kind of diagnostic services which would improve early diagnosis.